this is a very important story, and you will agree, of course, that in this entire matrix of who's more corrupt, I think this concerns you and I, the people of Karnataka, as it were. And Vajji, also correct me, wasn't Dr. Sudhakar at the time health minister when the COVID crisis had broken in Karnataka? So tell me something, where does one go after this? Will the investigations be initiated, Vajji?
Well, yes, Sudha, you are right. These are things that concern all of us, in fact, and this report that we are highlighting to our viewers is something that is exclusive and exclusive to us. It is something that indicates the corruption that took place during the COVID-19 time, highlighted by the Michael Dacuna report. Now, Mr. Sudhakar was the health minister at that point of time, but before then, it was Sri Ramulu who was the health minister. But if you look at the chain of events, this report clearly indicates how there were mismanagement with regards to the lab testing that had taken place during that time. If you remember that during the COVID time, the ICMR was the central body which was giving orders on how the state should handle its COVID protocols. And it had also designated a few testing labs in the various states that these are the labs in which we have to get our testing done. What this COVID report, what this Michael Dacuna report indicates is that 14 such laboratories were utilized by the Karnataka government at that point of time, which were not verified by the ICMR. Now, these testing labs were given close to 6 crores, and out of which there are a set of 8 labs which were given money without their services. That is why this report becomes even more important. The other thing that you would ask, what will happen after this? For now, what we have is the interim report of the Michael Dacuna report. As soon as we get the complete report, that is when we'll get an idea on what the government is doing. But we, as of now, have access to the few pages which includes corruption in PPE kits, which includes corruption, indication of corruption during for testing, and it also includes corruption in the places where advertising was done on the tune of on the orders of BBMP BMTC, when it had nothing to do with the entire management of health and services.
Vajji, I remember at that time, even the figures, the death figures, everything used to be a big sham. That's what some people said. Pardon. They said that how come, the figures are different for 1 week, then it would change for the next week. These are claims made by others. But somehow I saw videos from doctors, who would upload these videos and say, see, this hospital where I'm working, private hospital, one day they are charging 600 rupees, the other day they are charging 1200 rupees. Patients also had a problem. Isn't it true that somewhere then the Karnataka government decided that they will put a cap on the testing?
Well, yes, the cap was actually put by the central government in this matter, because it was the central government that was deciding. If you remember, so that we were under the Epidemics Act, and under the Epidemic Act, it clearly mentioned that whatever protocol that has been followed in the entire country should be given by the central health ministry, and the state is incumbent but to follow that protocol that has been given by them. So all the details that any state, be it Karnataka, Maharashtra, Kerala, or you name it, had to follow what orders were given by them. They had designated testing labs that were decided by the central government. They were designated PPE kits provider that was decided by them. It was only on the later stage, when the demand was high and the supply was not there, that is when the Indian companies were roped in, and they were advised to start producing more and more PPE kits. You remember there was an entire where we saw a lot of companies coming out and producing sanitizers, a lot of companies coming out making masks. And then there was another order that said that there are only certain masks that will help you save yourself from COVID-19, and
Right.
N95 came into the picture at that point of time. So all these things, protocols that were given by the center, but here in this report, it clearly shows how there was mismanagement done by the then state government by not following those orders, and by giving
Yeah.
contracts to companies that were not in the list.
But you tell me something, you have access, you've gained access, exclusive access, if I may say, to the interim report. And I want to ask you that as a journalist who's been following this story and breaking several aspects of it, What is the main thing that stands out for you in this Daquina report?
Well, the main thing that stands out, if you ask me, is how there were testing labs that were given work with regards to testing the problems or the testing the problems that people had or COVID testing at that point of time. Because if you remember, when it comes to PPE kits, these were kits that were not available easily for us. And that time, you had to procure whatever you could from anybody. So when it comes to PPE kits, anything we could have got our hands to at that point of time was fine. Testing was something that was very important because that was the one that could tell us that this person has COVID or that person has COVID. But if these labs were did not have those criteria, did not have
All
those
right.
preparations for testing, and if these were the labs that were given the responsibility of testing the
All
people
right,
of
Vijay.
Karnataka, then it clearly gives us an indication that yes, there was mismanagement.